As we speak, every minute, 3 people are dying. And they're dying because they cannot get the diagnostic test that they need to figure out what is killing them. To help you track this crisis, I have put a counter with red on the top corner of the screen. Good morning, ladies and gentlemen. I'm Dr. Arka Banerjee, and today I'm going to talk about how we are making complex diagnostics lab-free. So 4 out of 8 billion people on the planet right now have little to no access to diagnostics. Where there should be 20 tests, only 1 is happening per person on an average. That means the treatment that goes into these people goes blind, and that basically means the outcome is quite poor. Now, the reason behind this crisis can be summarized as really expensive reagent and devices because they're not very scalable in manufacturing, shortage of trained personnel in these regions of the world, a distributed healthcare system where the doctor, the patient, the diagnostician stand hundreds of kilometers apart from each other, and very importantly, out-of-pocket cash payment, which means the patients are extremely price-sensitive. With all of this in mind, ATS Bio is introducing the Quantar cartridge for RT-qPCR, which are infinite plex at point of care. What does that mean? That means simply load your blood sample, urine sample, throat swab, stool sample into the cartridge, simply put it in the reader device, and 40 minutes later, read as many infectious disease readout that you need to read out of this system. What that means is, doctors now do not have to ask, does the patient have hepatitis? Do a test, and then iteratively keep going until they have found the right disease, but rather, doctors can ask, what is making this patient sick? The machine will answer. Of course, this gold standard of diagnostics has been attempted by many companies before. But either their machines ended up being too large, too complex, too expensive, or they could only test 1 to 4 indications per sample. Now, since Quantar has beaten both these problems, it opens up a 10 billion serviceable market for us in low and middle-income countries. Of course, we are already making revenue, 6-figure revenue out of that billions by just enzyme sales to Thermo. We have just concluded in animal health a trial with Proan, which is the world's largest protein-producing company from animals. And we just started our chemistry's clinical validation in India with our partners. Now, all of this is brought to you by a team of trailblazers. Our CSO is a highly cited molecular biologist out of Cambridge University. Our CTO built world's largest and Europe's first microfluidic manufacturing company and sold it. And I bring consulting experience to the mix. And thanks to our coaches, we are here today. With that, I would like to thank you for your attention, and hopefully with your support, we can stop the counter right at 9, and billions more will thank you too. I look forward to your questions.